Welcome, welcome to Living and Loving Each Day. My name is Sue Jansen. I'm so glad that you're here with us today. We are delighted because we've got a returning guest. You're actually, Cindy, you're my first returning guest, which is because you have so much to say, right? And you continue to make significant impact on the realm of caregiving and advocacy for those who provide unwavering support in the realm of caregiving and in support of their loved ones. Please join me today as we welcome Cindy Sim, an accomplished businesswoman, innovator, and passionate caregiver. But before I introduce you completely here, I want to tell you more about her first. She is no stranger to challenges faced by caregivers right across Canada, not just locally in Edmonton, Alberta, where we are today. And recognizing the growing burnout, the depression, and the financial insecurity experienced by unsung heroes, she embarked on a mission to make a difference. And she is now the founder of Team Care Pal. It's an Edmonton-based entrepreneur endeavor, and Cindy has created an innovative app and software that fosters family collaboration. It simplifies resource access and promotes mental and physical, I'm sure, well-being for the caregivers who are taking care of their loved ones. So through strategic partnerships and leading care organizations right across Canada and utilizing cutting-edge technology, Team CarePal is transforming the way that caregivers are supported. This is what we're talking about today, is support. By acknowledging caregivers and as an integral part of the care team, Cindy's groundbreaking platform, it bridges the gap between care and organizations and the people who are involved. So without further ado, I want to just hear all the latest not upsets, but updates from Cindy today. Cindy Sim,
Wow.
you're so welcome here today, and thank you so much for joining us.
Thank you, Susan. That was that was incredible. I need to hire you. You can promote me from now on.
Well,
Yeah, thank you so much for having me. There is a lot. There is always a lot to advocate in the caregiving space. There needs to be more light shone. There needs to be more discussions, and there needs to be more support. So I will tirelessly, fight for that. A quick, update on T Care Apparel. Yes, we are launched. We are on both app stores. Things are moving. We're building our affiliate program right now. We have employers wanting to provide us, to their employees, because we know 1 in 4, Canadians are caregivers, and this impacts them working and their work-life balance. We're going to be building out our health organization platform, which will connect organizations right to the caregivers application. So super exciting. Our year is full. It's full. We've hit the ground running, and we are tirelessly just banging it out.
oh, and long gone are the days where you quietly in isolation care 24/7 for somebody that you love, and with no help and no, maybe other family members are helping, but no coordination. So you've come so far, like you've
Yes.
developed so much. So tell us more about the newest updates, because we had you on last, you talked about the app. So I know that so much has happened since. So what are the greatest updates? And I'm sure there's lots, but can
Ah,
yeah, go
There's
ahead.
there's so much. One of the greatest things is we're going to be looking at how to leverage the information that we learn from caregivers in our application to really be proactive. And so, based on that, we're going to be able to predict when a caregiver is about to burn out and take
Mm.
active steps to prevent that, to really promote self-care, and to really, dive in there and connect them with organizations in which they're really going to need support from.
So
So we're super excited
how do
about
you
that.
do that? How do you do that? Like how I'm now, I just go back a little bit. Now I'm just curious, now when you said that, how can you help them when they need that help?
Oh, yeah. So, when they join, into the application, there's a caregiver burnout assessment tool in our app. And we really wanted to empower caregivers to understand their burnout levels. One of the biggest things with looking after a loved one and managing work and managing your families and your own household and all the things. I mean, these caregivers, they're burning out at such an incredible rate. And, once they hit burnout, their loved one risks being, institutionalized recognized, and they end up maybe being placed into long-term care when they shouldn't be. 1 in 9 long-term care beds here in Canada are filled unnecessarily due to the lack of support at home. And we know Canadians want to age at home. We all do, and we need to start supporting that. Our healthcare system, is struggling. Resources are running thin, and with our amazing, elders coming up, we need to support, at home care as much as humanly possible. So, by empowering caregivers in our application to monitor their burnout levels, we'll be able to send them resources based on their burnout level. So if it changes from month to month and all of a sudden they've had a hard month, maybe they're not sleeping well, maybe they're feeling isolated, maybe they have stopped seeing their friends. I mean, we can make suggestions and we can send them to a caregiver coach that's near them, or maybe some peer-to-peer supports. We can get them the resources that they need and really make suggestions on how they can proactively look after their self-care.
Because they, for a lot of them, forget that
Yes.
they're caring, and they love their loved ones so much.
They
And
do.
we're talking anywhere from the children, that you might be a care provider for children and aging seniors, or
Yes.
people who are physically or mentally disabled. Is that correct? So
Yes.
the
Yes.
way it could be any
Any.
individual, any help. And so they need to, that's the biggest thing that I think we all know about is, and I don't know if it's kind of comes under the category of women a lot, but a lot of people, the self-care is not number one for them. They're looking out after the other person and they kind of forget about themselves.
Yeah. And I think you're absolutely right, Susan. And I think we have to take the example of when you're on an airplane and that oxygen mask pops down, you need to put it on yourself before you put it on somebody else. And so we really have to implement that at home too, where we really have to make sure that we are looked after so that we can provide the best support that we can.
Mm. And you're helping make that happen, and with that support. I think just knowing that you're there, like that Team Care Pal is there, that
Yes.
just that alone, I think, would be reassuring to people who are taking this on. So tell us about the youth. So you've got something exciting happening.
Yeah, well, there's, the youth. Let's talk about our young caregivers for a minute.
Okay.
A lot of us, we tend to focus on our elder population, as more of a focal point because there is a large amount of them. But our young caregivers just do not get recognized and do not have the support that they need. And I really want to take this moment to advocate for them while I'm on the call with you.
Good.
These are children, youth, young adults who are selflessly providing care for that family member that faces challenges such as like your chronic illness, disability, mental health, maybe substance misuse, or even socioeconomic factors like they don't have access to health care. And so they support their family members in so many ways, from like grooming, medication, maybe dressing, and even emotion support. And they are just not recognized. And this is so unfortunate because there's about 1.25 million young caregivers across Canada. These are ages 15 to 24 years old. And this is back from the 2015 general survey. And so this doesn't even take into account
Wow.
Northern Canada or children under 15, which is heartbreaking. These young caregivers dedicate on average 14 to 27 hours per care per week. So this is like the equivalent of a part-time job on
Mhm.
them.
Mhm.
The reason why this is so upsetting is because this affects their school performance, this affects their social well-being, and this in turn, it's like the young caregiver penalty is what happens. The young care penalty is from Dr. Stamalopoulos, and it is when a young caregiver's well-being and development is compromised because of the lack of supports and safeguards. So
Right.
when a caregiver sacrifices, joining a sports team or being able to study at night, or even making that choice of wanting to go to college but they can't, or having to take on another job because they have to help financially to, provide food for the family. I mean, these are all things that sacrifice, their long term, and this is their lives. On average, the care that they provide, saves our healthcare system a significant amount of about $25 to $50,000 annually.
Mhm.
And there's just no support, and they don't feel recognized. And a lot of times, after they grow up, they have these really big feelings. They feel like they've lost their childhood. They feel, they might have symptoms of anxiety and depressed, because of that loneliness and sadness. And yeah, and they just don't feel recognized by a lot of our professionals out there from the healthcare system,
Mm.
the teachers. Like, we need to better support them. So I really wanted to bring a light on them today.
Oh, good. Can you give me like a really good example of when that situation would arise? Like, I just to give me a picture of who are they helping? Like, what are their, what are, yeah, like some examples of.
Yeah, of course. Say, a 15-year-old may be, with a single parent who, has substance abuse, right? So that parent may not be fully able to provide the care that they should for the child. And so a lot of times then that child might have to, make their own lunches or try to figure out food for themselves, or, try to figure out clothing, or even look after, the parent as well, right? Depending on the condition that they're in. And so, that really impacts that child's ability to do well in school, to
Yeah.
have friends, to, do those things that children should be able to do. And that
Mhm.
affects them long term.
Right. Okay. That gives me a kind of a just a clearer picture, because
Yeah.
sometimes it's like, well, you can come up with ideas, but it's really nice to kind of figure that, to know exactly.
Yeah.
So what are the things that are in place to help these youth?
Oh, not as much as there should be, which is why we're advocating for them.
Okay.
But I would love to do, a call out to healthcare, teachers, social workers, home care providers. If we provide these young caregivers with the right tools and recognition, we can really prevent this long-term harm. They would experience improved educational outcomes and have better employment opportunities. And so
Mhm.
this is a call out to everyone that if you know a young caregiver, please direct them to the Young Caregivers Association. So, youngcaregivers.ca, they have an amazing virtual powerhouse program that was developed to teach young caregivers life and personal development. And it provides, opportunities to connect to other young caregivers. It
Mhm.
brings families together. It reinforces that self care and ultimately builds, resilience among these young caregivers. Another thing to look out for is Caregivers Alberta, right here in Alberta, is going to be doing a pilot with the Young Caregivers
Oh.
Association because they see this massive gap in our system as well, that there is
Mm.
just not enough support. So they'll be doing a pilot this fall here in Alberta. So stay tuned to that. The Young Caregivers will be getting support closer to home, and just take, care and spread the word and share the stories. And, at this point, it's really about advocating. So in Team CarePal app, again, if they're a young caregiver in our application, even up to 20, 24 years old, using our app, we will be sending them, all the resources that are available to them
Good.
right to their fingertips.
Oh, that's fantastic.
Yeah.
That's really good news. So, and
Yeah.
I'm sure once this word gets out, you'll make even a greater impact. And and they're going to go, you're really talking to me? Are you really, is that for me? That's
Yes. Yes.
so great. So what else is kind of like, I know you've grown just since we chatted. That was, we did a podcast way back, and I'm just wondering how, are you exploding yet? Because I remember signing off that day and thinking you are going to explode like all over. You're gonna do
Yes.
so well. So how are you doing? Like, I mean, I'm sure you're just growing.
Yeah, things are, really, really great. We've had an incredible amount of downloads in our first month, which is just so sweet. We've had an incredible amount of support, people promoting us. And then, of course, we've hired a couple employees as well to help manage the workload.
Good.
We already, like I said, have employers, signed up to share us with their employees. We have health organizations just waiting on standby to pilot us within their organizations to connect with caregivers and support them even further. So we couldn't be more grateful at this point.
Oh,
It's a lot. There's a lot of pivoting, a lot of learning, a lot of validating. But I have an incredible team and I couldn't be more proud of what we're doing.
oh, that's so good. And I'm happy to hear that the person proclaiming self-care is doing some self-care. That's good. We need you to stay strong and to, keep doing this. So tell us, how can people just get involved, or how can they find out more information about this? So just give us all that kind of lowdown on what's your website and how they can reach you. Okay.
Yes, definitely. Go to teamcarepal.com and you can find out we're available on both app stores. You can read through and see what we all have to offer. You can connect with me, Cindy, at teamcarepal.com. For the young caregivers, go to the Young Caregiver Association.ca. If you're looking for coaches, caregiver coaches, yeah, I mean, every province, has their caregiving association, Caregivers Alberta, and that source. Again, you can find all that information on our resources on teamcarepal.com as well.
And I'm sure you're on LinkedIn and Facebook and all the other, they'll,
Absolutely, yes.
they'll find you everywhere, because
They'll find us.
it's important that they get in touch with you, and especially if they just don't have a question about, well, maybe I need support. Like, what if there's somebody out there who actually is in a position that they need somebody to take care of them, and they don't have family, or they don't have a person taking care of them.
Absolutely.
There's other agencies, I'm sure, but
Yes.
there's other options, and I'm sure you just kind of pass them along. How do you handle that? I'm
Yes,
curious.
so we just we promote the organizations in which the person lives by,
Okay,
because there's so many amazing organizations out there that are ready to help. The biggest pain point is that caregivers just don't know where to go.
exactly.
So by connecting them, there's navigators out there. They're willing to help you navigate the healthcare system if that's what you're looking for. If caregivers want education, we'll connect them, to those education. If they just want to learn a little bit more about their role or about their loved one's condition, we can connect them with that. So, just based on their needs, we can send them all those tools and resources that they need.
Oh, you've already established and created so much already. You're doing so well.
Thank
I'm
you.
proud of you for our province, and I know that this, like you said, it is across Canada. So
Yes.
be sure that people can actually find those links, I think, on your website as well. Is that correct?
Absolutely. Team CarePal is global. So
It's
anybody in the
global, not just
world,
Canada. Good.
yes, anybody in the world who wants to use our application that can speak English at this time, can definitely use it. Again, like I have family all over the world, right? So looking after, one of my loved ones, I would want my family from Holland or my brother from Sweden or wherever to
Yeah.
join the application and be supportive and be included in our loved one's care. So we're global.
So we're keeping loved ones together, and we're supporting all of them, both sides of
Yes,
this. So, uh,
everyone.
Cindy, you're so great. Thank you so much for coming back and just kind of updating us, because I know that a lot has gone on since the first time that we chatted. And congratulations! I mean, you and your whole team deserve just so much, just a applause. I mean, I was trying to, all these words just came into my brain at the same time. Just applause and appreciation for all that you've done, because the need is so great. And I know that that's why that was the seed that was planted for you when you started all this, because you understood that need. So,
Yes.
so everybody, please, if you have any questions or want to reach out to Cindy, please go to her website. It's right there on the screen. And there's more details in the description about this podcast as well. And I want to thank Cindy, especially for joining us here today. And thank you for tuning in. And let's just keep this word out, get this word out, and just help support each other in this role. If you know of anybody who's in this role. So go to livingandlovingeachday.com, and you can subscribe there and keep in touch with me at that place too. That's a really good place for us to connect. So again, Cindy, you're an angel. Thank you so much. I appreciate having you on today.
Susan.
And thank you everybody for joining us today. Really appreciate you being here. Thank you. Okay. Bye.